Pregnancy can be very hard on the lower back and hips. As a massage therapist, one key thing is to work on the area that hurts, but also the areas that affect the pain. Let's go through some techniques that can really help pain relief, but also some mistakes that massage therapists may be making. A pregnant client may be complaining about their SI joint, but the massage therapist needs to work on the other areas affecting it. Pain can be located in one place, but be caused in other areas. One of the techniques I like to do is go across the lumbar muscles along the spine. Depending on the stage of the pregnancy, the lumbar extensors could be working overtime for months. Another problem a lot of therapists have is they work too fast. Fast pressure can cause the muscles to fight back. Slower pressure helps the muscles relax into it. When the muscle tissue begins to feel safe, it's going to start to relax on its own. Another common mistake is when massage therapists are afraid to use their forearms or their elbows. These are just tools. They just have to be done the right way, using broader techniques and pushing the angles away from the belly. Remember that just because a muscle feels tight doesn't mean it needs to be worked. It could be tight because the muscle's protecting something else. Trigger point work on prenatal massages is absolutely okay if it's done the right way, working within the client's comfortability and tolerance. I usually hold trigger points about 3 to 5 seconds. Afterwards, spreading blood flow and relaxing the muscle tissue. Side lying is another effective massage technique for prenatal massages. It's a great way to get into the hips and lower back. I put a pillow under their head and then another body pillow in between their arms and knees. Now this client is an experienced client of mine, so she's already used to a lot of pressure. So I would work deeper on her than I would normally. If you have a newer client, I would actually recommend to work lighter in the beginning and let them know that if they handle it well, then you'll go deeper the next time. They like to see that you're personalizing it for them. Communication is key when it comes to any massage treatment, and the client loves to see that you have their best interest at heart. Whether you're a massage therapist or a client interested in prenatal massage, let me know in the comments below if you have any questions. I love doing side lying. It's one of my favorite positions for prenatal when treating the lower back and hips. When side lying, it allows the muscles to fully relax, and you can get access to the glutes, lateral hips, and muscles along the spine. I also like to address the lats and side muscles. The lats attach into the fascia tissue and the pelvis. When they are shortened or overloaded, they can increase tension through the lower back and limit overhead shoulder mobility. By lengthening the lats along the rib cage, we can often reduce the pulling force on the spine, improve trunk rotation, and restore comfortable movement. Even though it does help open the shoulders, make sure you don't overstretch the muscles with working on prenatal clients. They cannot recover as fast as regular clients. A common mistake would be only treating the hip or lower back part that hurts. While yes, that sometimes is appropriate, many clients develop pain because the body is actually compensating, not because the painful side is the only side with dysfunction. For example, a client might complain of right hip pain, but the left hip may actually be weak or restricted. As the body shifts more weight on the right side, those muscles work harder to stabilize the pelvis, eventually becoming overloaded and painful. That's why I always treat both hips, both sides of the lower back, the painful side, and the other one that needs treatment as well. Reduce muscle guarding and tissue overload, while the opposite side might need work to restore mobility, improve muscle function, or address compensation patterns that contribute to the pain. Check out my full prenatal playlist when you get a chance, and please save, repost, and follow. Thank you so much for watching, and I'll see you guys next time.